My name is Courtney Wheeler. Before we get started, there's a few things I would like to go over. Just a disclaimer, the views expressed in this webinar are those of the presenters and are based upon their extensive experience and expertise. This presentation is not meant to diagnose people or provide clinical advice. The agenda for today, after the welcome, we're going to have an opening prayer, followed by an introduction, go over a few housekeeping, and then we'll proceed into the presentation by Dr. Segay, followed by a Q&A portion. Dr. Segay, would you like to start us off with a prayer?
Yes, good afternoon, everybody. I'm Dr. Segay. I'll go ahead and open with a prayer. If you can all bow your heads. I'll be praying in my own native language. Oh, ahiki ahiki anskinete ado nashte nihidene bilbato zinti kwa anaut igi ishli na that ado halet ado les that hiki bayatoski and jonago naka di lis ado and jonago di ado nantai di patient se case bite uyo nantai sente din jono do nis ado ate dus for die qua is akasligi between lodo project die shit auto ba holiado die dogan ba chine ba haski ba santa eshi ta halno auto and da inish bikini to auto ba holiado auto di na nihiki ba hadil sto ya ta hasne sto nihiki to di to nihito dol nata بالناس ناس نانا نهي نحن دوت أذكر خبيجة دولة هتا لجد فلديسي دوش ما بنشني دوش عشان كهذا ديشني هتا لجد فلديسي هجنا هسلي Amen. Okay, Courtney.
So we're going to do a brief introduction just to let you know who we are. Dr. Segay, would you like to go first?
Yes, thank you for giving me the floor. Good afternoon, everybody. Thank you for making the time to join us today. I'm Dr. Glorinda Segay. I'm of the Navajo tribe, and I work there at NIHB with the public health policy team, and I specialize in the behavioral health and mental health care. And so I'm happy to present to you during our webinar series that we're hosting. And I just want to say thank you ahead of time to NIHB, also our leadership, Courtney, Kelsey, for taking notes, to make all this happen. Thank you.
As briefly mentioned, my name is Courtney Wheeler, and I work on the Behavioral Health Project with Dr. Segay, as well as a few other projects here at NIHB. So a few things before we begin. We will be using the chat box located at the bottom of your screen for all questions and comments. We will be checking that chat box periodically throughout the presentation in order to address any questions or comments that you may have. This webinar is being recorded. The recording as well as the slides will be available within a few days after the webinar is complete. We will do our best to follow the agenda. And again, if you have any questions, please put them in the chat box. At the end of the webinar, you will receive an email with a link to an evaluation. We ask that you complete that evaluation as it helps us in future webinars and other events that we have. So today, at the end of this webinar, attendees will be able to describe any common elements of substance use seen in American Indian and Alaska Native communities, describe the impact in AIAN communities today, comprehend the DSM-5 diagnostic criteria for substance use, recognize differential analysis of substance use, and explain strategies for management and treatment of substance use. The National Indian Health Board was created by the tribes, and we advocate on behalf of all 574 federally recognized tribes. Just a little bit of background about NIHB. We have 3 different departments: Public Health Policy and Programs, which is the department that Dr. Segay and I both work in. We also have a Policy Center as well as Congressional Relations. We do a variety of things ranging from advocacy to public health programming, technical assistance, just to name a few. Dr. Segay, would you like to begin?
Yes, thank you, Courtney. So here, I'll go ahead and direct everyone to the slide. So the slide here, substance abuse statistics that Courtney and I found. And so we're going to go ahead and review among the American Indian and Alaska Natives first, and then we'll go into the non-Native. And so here, looking at what the slide indicates is that with the AI, AN, American Indian, Alaska Native, I'll go ahead and use that, it's higher than the general U.S. population, and also have the highest rates of alcohol, marijuana, cocaine, inhalants, and hallucinogens use disorders compared to others. 10% of American Indians and Alaska Natives have a substance use disorder. Next slide, please. And a continuation, so 4% of American Indians and Alaska Natives have an illicit drug use disorder. 7.1% of AIAN have an alcohol use disorder. And substance dependence or abuse is higher among AI and AN. And of course, methamphetamine abuse rates is the highest among AI and AN. Next slide. So here, comparing to non-American Indian and Alaska Natives. So according to NSDUH, 19.7 million American adults battle a substance abuse disorder in 2017. So we were looking for recent stats, and this is what we found. Almost 74% of adults suffer from SUD in 2017, struggled with an alcohol use disorder. About 38% of the adults in 2017 battled an illicit drug use disorder. The same year, 1 out of every 8 adults struggled with both alcohol and drug use disorder. In 2017, 8.5 million American adults suffered from both a mental health disorder and a substance use disorder or co-occurring disorders. And drug abuse and addiction costs American society more than $740 billion annually in lost workplace productivity, healthcare expenses, and crime-related costs. So we just wanted to draw a picture in your mind, paint a picture to see kind of where American Indians and Alaska Natives gauge in the general population. So I hope this is helpful. Next slide. So what is substance use? I'm sure we've had conversations with our friends or colleagues, you know, and talking about what is substance. So there's a lot of misunderstanding sometimes, and sometimes people interpret in their own ways, you know, and so that's what we're going to discuss today. And this is all generalized. Next slide. So here, what substance is basically the use of substances. And so here's a list that we put together: alcohol, inhalants, hypnotic stimulants, and basically it's to alter one's physical and mental state. And so that's what we described it as opposed to the clinical definition, which is the DSM-5. The revised version indicates that it's basically the brain's and the body's growth or dependence on a substance to cope with adversities. And so that's what they have it listed as. Next slide, please. So here I wanted to share the clinical criteria of SUD. So again, please keep in mind that we're not providing any clinical diagnosis or recommendations, you know, by providing this information. This is just general information, you know, for your education. And so in the DSM, their clinical criteria is as follows. And so again, keep in mind also the DSM has a specific timeline which a person has to display what they refer to as symptoms and or signs. And so here, loss of control overdrug and alcohol use, investing large amounts of time obtaining substances, cravings, continued use in spite of relationship conflicts, risk-taking such as using while you're driving, continued use in the face of developing health problems. And so that all sounds pretty familiar. So I'm sure we know, with some community members or maybe in our personal lives, our friends, we kind of see this just by their actions and their demonstration of how they carry themselves, so that there is something important to pay attention to. Next slide, please. And here are some more signs and or symptoms. Increasing tolerance level, that means they're trying to drink more to get the same high, or they're trying to use more drugs to get the same high. A lot of them refer it to chasing the high. So lots of interest in activities they once enjoyed. So a lot of times they start to isolate themselves. They don't want to do what they used to like to do, maybe horseback riding, hanging out with family. And then they go through withdrawal episodes. And a lot of times they spend a lot of time in recovery. So they sleep a lot, they're irritated, they're trying to get through the physical aspects and also the mental. So they're going through the guilt trip, feeling convicted, so we're looking at it in that aspect too. Failed attempts to stop using. So maybe they went to outpatient treatment, based on a treatment plan. They came maybe once a week, twice a week, or you're going into rehab. How long have you been there? Maybe it's a 90-day rehab. And so although they went to get the help, that seems to be not sufficient enough to them, to recover. And I mean that respectfully. So even though they went there to get help, they continue to use, so they relapse. And then another big demonstration that I see is failing to meet obligations. So they know they have to work, they know they have to make money, pay bills, buy groceries, whatever. Or maybe at home, the home starts becoming messy, the laundry is not being done, the dishes are piling up, even school. Maybe some of them are students in school, whether it's high school, college, professional, trade, what have you. So they start to decline in completing homework, attendance, punctuality, things of that. And so those are more signs and symptoms. Next slide, please. So just be mindful. There are other classifications. People get into a debate sometimes, or maybe they get confused. So again, I just want to provide this information that there is such a classification of substance misuse. So here, this is referring to the use of substances for a purpose not consistent with legal or medical guidelines, most often with prescription medications. So one of them is opioids, so painkillers. It's only supposed to be taken, say, 250 milligrams, twice a day, morning, evening, something like that. But they're taking more. They're taking 2 more additional pills, out of the time frame. And so that's an example. So substance abuse is the uncontrolled use of alcohol, illegal drugs, or prescribed drugs affecting normal daily life. We call them ADLs. So again, earlier, as one of the signs and or symptoms, I indicated that, they fail to meet these obligations. And so that's where all this interference starts coming in. People start calling in for work because they're hanging, they're going through some sort of withdrawal. Sometimes the withdrawals can be psychotic. It can present with those kind of features. And so they're basically, covering up. To them, it's like they're covering up. But from the outside looking in, it's like, okay, something's going on here. So I just wanted to make that distinguishment. Next slide. So here, during this pandemic, we're starting to see a lot of behavioral and mental health play out, whether it's conditions, circumstances, situations, it's playing out. It's playing out, because we're looking at all these factors that are happening externally. we can't go to work. Some of us, we don't have telework. Some of us, are bored inside. We just are confined in one location, maybe in an apartment. Some of us, we're used to being with family members physically, cooking out, mingling, but now all that is taken away for the time being. And so that's where we're seeing substance use on the rise. It's happening more frequently, but of course we got to look at the different factors that are involved. And so this is where the beef is, and this is what we want all of you to know about and be cognizant of. Next slide, please. So according to studies, basically compromised lung function because of COVID may put those who use opioids or meth at risk, because again, some people are also presenting with pre-medical conditions. So some might have, respiratory illness or obesity or diabetes, so we're looking at all that. And so again, looking at a person who uses opioids or meth, we kind of already know what's going on with their physiology. So it puts them at risk. And so two things could happen, cardiac, pulmonary, or brain complication. Breathing will decrease. And so, of course, with COVID, that's one of the signs is, your O2 level drops. And so we're paying attention to body temperatures, things like that. So just think if you combined, if you're using opioid or meth chronically, then you combine that with COVID, it's like, we're in a deep pickle here. And so looking at meth, meth is toxic, causes pulmonary damage, hypertension, and then there is also the possibility of increased risk of adverse outcome because of COVID. And so, and there's a lot more to this, coming from the medical aspect, but these are ones we wanted to highlight. Next slide, please. So again, looking at physical distancing may increase the likelihood of opioid overdose because no one's around to administer naloxone. So again, we're learning as we go. We're looking at law enforcement officers and, the first line providers. How are they structuring? What are they doing? How are they managing, situations like this? And so that's where we're finding a lot of gaps, just like the physical distancing, it's basically causing a gap to being able to have that physical care, compassionate care, what have you. And so we're looking at areas like that. So I just want to put that out there. Next slide. So here are some possible risk factors for substance users. Again, health instability, incarceration. We're looking at the federal prison system, the state system, local jails, tribal jails, poor access to healthcare and or recovery support. So again, a lot of us know that reservations, they pretty much are wide-based, the geographical location is very wide, and it's hard to get access to care in some areas. Just like on Navajo, some people have to travel 100 miles to the nearest clinic or hospital, and so keeping that in mind. So because of that, those become factors of getting, proper care, getting, the recovery that's needed, what the prognosis is going to be, the outcome of positivity and healing. And so, again, that puts that there. Difficulty with physical distancing. And so I'm just going to reference to the riots going on. I've been following that, and it looks like some of the individuals involved are on substances. Alcohol seems to be the drug of choice. And so once you're intoxicated, by drug, alcohol, what have you, all of your morals seem to kind of go out the door. All of, the laws of nature, the laws of a home, the laws of being a citizen, what have you. We seem to forget. And so that's where, that physical distancing becomes complicated. We start touching other people, physically shaking hands, hugging, what have you, or even just standing by somebody. And so that's a risk factor there that's very concerning, of spreading the COVID. Increased disease transmission in shelters. And so, for example, we do have like homeless shelters in some areas. We do have like a detox center, like here in Gallup, New Mexico, there is a detox center. And so a lot of these individuals, they have nowhere to go. And, you know, some of them have no homes or families to go back to, you know, in the meantime. I know as American Indians, Alaska Natives, you know, we're kind of like Smurf Village. You know, everybody's welcome, you know, to the homestead, you know, and so because of, you know, the shelters being cluttered or what have you, or the homes, you know, that's where we're at risk for the disease transmission. So that's very scary, very dangerous, a way to spread, you know, like wildfire. Next slide, please. So here I just wanted to give a general scenario, case study, whatever you want to call it, of an individual. Basically, this person is not a patient. It's just basically created in my mind. So I think that's called non-fictional, I think. So next slide, please. So during this time, this pandemic, the way that substance use might play out is, say, for example, you begin as an ordinary day, do your regular, you know, wake up, take a shower, whatever. So here we'll use JW. So here's some information on JW. Living in an apartment in a city. So a lot of times maybe a 1-bedroom, very small little area, square footage. Has a job with minimal pay, but because of COVID, you know, it's kind of day to day. Some days he will miss work due to alcohol withdrawals and his fear of contracting COVID. So kind of just playing it out. Do I feel like working today? Maybe. No, I'm scared, you know. No transportation. He has a son, but has no contact or involvement with him. Also has no stable relationship with family. And so there's friction there because of youth. Friends are alcoholics who also use marijuana and meth. So going back into history, JW, you know, his preference is using whiskey, Jack Daniels, marijuana, meth. JW went to rehab, but continues to relapse. Sometimes he'll refer back to the big book through his support group of AA. He disclosed his last use of whiskey was 1 week ago and meth about a month ago because he's bored. He says, I'm confined in one area. Nobody checks on me. Nobody cares. I get bored sitting in the apartment all day. So he does have a TV, you know, and Wi-Fi, but you only can entertain yourself, you know, so much with that. Next slide, please. And basically continues to say, I have nothing to do or look forward to. I hate this COVID because it's ruining everything. Can't see my friends. I can't go nowhere. So I drink and get high. It passes time. I also crave it every day. So JW is a twin. Grew up in a single family home. Father passed when he was about 8 years old. He took his first drink of alcohol when he was 6, which was offered by his uncle. Also has a history of being in prison due to aggravated assault and DWI. No driver's license at this time. And so I just wanted to also paint a mental picture here, you know, to start thinking about in your mind, you know, I know people like this. They present with these features, you know. We know they have adversities or ACEs, adverse childhood experiences, you know. So I just wanted to get that going in your mind, you know, get the engine going of, you know, recognizing and being aware of, you know, what substance use is. Next slide. So here, discussion, as Courtney indicated earlier, go ahead and use the chat box. So here, just wanted to, you know, get some ideas, you know, since your brains are going right now. Based on what JW is exhibiting with, you know, what symptoms do you see that he presents with? What comes to you or what sticks out to you that kind of gives you the notion that, okay, something is going on here. Something's not right. Is there substance involved? If so, what kind? You know, so we're looking at all the information, the demographics, you know, the history that was provided. So next slide. So here in the chat box, I see that, you know, PTSD, so depression, anxiety, mental health, craving, and failure to meet obligations work. So thank you for the answer, Trudy, Donis, Laura, Knight. I don't want to ruin your name, so I'll just say Miss Knight, Veronica. Thank you for your reply to that. And so we'll go ahead and go into the slides of what symptoms are being exhibited by JW. Also, Sarah, social isolation. So craving, how did we know that? He said it right, I crave it every day. So that there, you check it off the criteria. Continued use despite of relationship conflicts. We don't know exactly why these conflicts are happening, but it did indicate and provide information that he has a son, but there's no relationship there, you know, with family or friends, and so maybe he burned bridges with them. Risk taking, such as using while driving. So there, one of the background information indicated, you know, he had a DWI. No driver license too. So that was one indicator. Loss of interest in activities once enjoyed. So he kind of touches up on my friends, you know, I'm bored. So withdrawal episodes, there we're looking at his use interfering with work. And so he's basically spending time recovering. I missed work, I was tired, whatever. Failed attempt to stop using. So here, you know, he basically went to rehab. You know, rehab again is a big deal. Maybe it was a 90-day rehab, I don't know. We don't know what type of, you know, treatment, excuse me, used in there at the time he was there. So basically, you know, he still obviously needs help. Failing to meet obligations. So here, within, you know, his job, he's allowing his substance use, his behaviors, the mentality part of when you're using substance, you know, it's interfering with him, with his job duties, you know, maybe with his ability to be a parent, I don't know, you know. So those are symptoms. Next slide, please. So what does this mean? Sometimes you get a person, you know, they do an assessment, or maybe they kind of sit down, they reflect on their behaviors, they reflect on their life, you know, they kind of sit there and wonder, or maybe somebody came at them at the right time, right when that window of opportunity of where, you know, they're thinking straight, with all due respect, and they're sitting there, okay, all this is happening to me. So what does it mean? How do I interpret? How do I comprehend? You know, how exactly? You know, so they have questions like that. So next slide. So here, you know, they're basically wanting to learn, you know, information about their condition. You know, what does that mean? How? You know, just like I had alluded to earlier. Some might ask, could I have a problem? Is this normal? Am I able to stop? How long will I do this? What do I do? Where do I get help? Is it because of COVID? What's the treatment for my problem? So I'm sure there's a lot of other questions they ask, but these could be the possibility of some questions, you know, when a person is right in the right, you know, mind frame, you know, at that moment, you know, or like AA says, they see the light, you know, they pretty much like the light bulb comes on, you know, okay, what's happening here? Next slide, please. So ways to prevent substance use. There's probably millions of ways, you know, and I'm sure you all have your ways that have been effective, you know, and so I just want to review some ways that we thought could be effective. Next slide. So here, possible activities to help to prevent substance use during this pandemic. So again, as JW had indicated earlier in the scenario, he says, I'm bored in this one little apartment, you know, nobody visits, I can't get no visitors, nobody cares, you know, so he kind of has that kind of mentality. And so this is where you can encourage, you know, that again, although this pandemic's happening, you could exercise. So home gym workouts, you know, maybe taking a walk if the area is safe, you know, if you live in a secluded area, biking, taking hikes, you know, what have you. So those are just some, even yoga or using the Bosu, you know, what have you. Or even playing with, if you have kids there, you know, social distancing, playing with them, doing an activity. So it doesn't have to just be like craft work. It could be making a picnic table, you know, or repairing, you know, something that's broken, the gutters on the roof, you know, you're looking for something to do. Spending time with your pet or animals. And so as natives, a lot of us have livestock. We have pigs, and chickens, and cows, and horses, you know. So tending to them, feeding them, watering them, you know, making sure that everything is good with them. And then for some who live in cities, urban areas, you know, most of them have pets. So they'll have like a dog, cat, or maybe a guinea pig or ferret, you know. So being able to spend time with your animals. Meditation seems to be effective too, you know, just finding a quiet place, you know, while you figure out your breathing rhythm, you know, clearing your thoughts, you know, so meditation. Listen and play music. A lot of people resonate to lyrics of music or maybe the beat of the music, you know. It could be any kind of music. It could be Native American church, peyote songs. It could be powwow music. It could be, you know, rap music, or maybe country western, or traditional music, you know, flute, or maybe even playing an instrument. If, you know, some people have that talent of playing a piano, a guitar, you know, what have you. Daily readings. So a lot of times, you know, there are reading material out there who basically present by calendar day. You know, this is what to read on this day, you know. Or daily prayer or meditation, and they kind of have it listed there. They do have it like with churches. I know they provide that material, and then from AA groups or Al-Anon, or even just reading a book, a general book, you know, like Lord of the Rings, or maybe love story, I don't know, but, you know, doing that type of positive outlet. Finding an online support group. Here I just want to stress online, because right now everything is virtual. And so looking for a group, whether it's AA or Al-Anon or narcotics team, what have you, looking online. Finding a sponsor to help with process too. So that doesn't require any kind of physical interaction. You can just call your sponsor and, you know, talk to your sponsor and process your current feelings, or maybe there was a trigger, something happened, somebody came by, or maybe you're just frustrated. Being able, you know, just to talk about it, to process it, to help understand. Breathing exercises, there's all kinds of literature out there. There's YouTube videos, you know, you can kind of look at that. How do I breathe? How long do I hold my breath? You know, how do I exhale? How do I inhale? You know, it gets really technical. Self-prayer, I just want to stress that, you know, a lot of us as natives, we go to our medicine people or elders, you know, for prayers. You know, but sorry about that. Am I okay to talk, Courtney?
Yes, you're fine.
Okay, I don't know. Okay, I don't know what happened there. I apologize for that. And so I say self-prayer, self-smudging, self-tobacco offering, meaning that you as a person, you don't need to go to a medicine man. You don't need to seek your elder, you know. You could do it there within your home. So a lot of us as natives, you know, we have access to our cedar, you know, our tobacco, our pipes, you know, we have that there readily available. So doing that for yourself. And then spending time with positive people in positive environments. And so maybe you have your elder, your grandma, your masana, or your elder grandpa, you know, and hanging around them, talking to them, you know, they have a lot of good stories, life stories and teachings, you know, to help you think about things. And their delivery style is always very unique too. It's ear-catching, it's eye-catching, it's heartfelt too. And so that's an example. Basically, just saying no to alcohol and drug use. And we've been teaching this since grade school. Red Ribbon Week, you know, we have ribbons that are tied on. Just say no, you know, and so that still works today. So just basically saying, no, I don't want to use, to offers. I don't want it at this time, so basically, that's still an effective measure. Next slide. Excuse me. So additional tips here, asking the group at this time, what tips or maybe skills, do you know about that helps to avoid or reduce substance, use during this time? Go ahead and share that with us in the chat box. Maybe we're missing something. Maybe, we're overlooking, some tip that might be effective. And so feel free to share. So from Kim, talking to others, Alyssa says having a support person, like we said, it could be a sponsor or it could be a friend or a relative. So, and then Donis, journaling. So journaling helps to read what is written, how you made it through another day, so you can reference back to, oh man, I remember I kind of had similar feelings. Let me go back and see how I dealt with it. Self-care, spa day, facial, manicure, pedicures, for those of us that have the resources, we can do that. Listening to podcasts. So Kim also is sharing that. Thanks for joining us, Kim, by the way. And also Trudy, gardening, hiking or walking on the beach. Maybe if you're near a beach, that'd be helpful. Sometimes reservations are flat, sometimes they have really beautiful landscape. So walking in those areas. So thank you for the additional tips there, everybody. Next slide, please. Cooking. So Jordan says cooking. Cooking's always good. So here I just want to touch on substance use treatment. Again, so we're looking at what has been effective. So that's where we're coming from. We might have missed something. We apologize, but just wanted to share what's most effective. Next slide, please. So here, substance use treatment, I'm just saying use, again, being mindful of the other classifications of substance abuse and misuse. And so, again, we're just trying to keep it general here. So here, again, a person has to meet clinical symptoms in a certain time frame to be diagnosed with substance use disorder. So if treatment is not sought, it can get worse. So keep that in mind. There's no single treatment that's effective. So what works for one person may not work for another, vice versa. People need to have immediate access to treatment. And so, that's very important. I know on reservations, it is hard, to get someone immediately, because of geographical location and all the factors like a reliable vehicle or having gas money, Effective wraparound treatment addresses all of the patient's needs. And so just like with JW, we kind of saw what he might benefit from, mentally, like, oh, wow, he might benefit from parenting, or he might benefit from, getting help from social services, things like that. So wraparound, it doesn't have to be direct to the chief complaint. So staying in treatment long enough is critical. So maybe 90 days is enough. Maybe after 90 days, a reassessment's done, and you modify the treatment plan. Okay, I think maybe 120 days. So I've known people when I was still practicing as a provider, it took them 3 years, 22 months, they talked about it. It took me this long for me to get it. And so a lot of times they disagree and say, 90 days won't do nothing, But again, like I said, no single treatment is effective. So you gotta try almost everything. Next slide. Counseling and other behavior therapies, including cultural services, are most commonly used, for treatment. So again, I just want to touch up on traditional services, cultural services. Whether you're doing a sweat lodge, I know on Navajo, a lot of their outpatient treatment centers, tribally, they have a sweat lodge. And then they also have a prayer ground too, like for TP, peyote meetings, they have that there. And so those are good ways. And then on the inside, the treatment centers, they do a lot of talking circle, smudging goes on in there. So I just want to highlight that, that there's people who actually come into tribal clinics and, they don't want the Western modality of health. They want to go back to the traditional, I want this. And so, again, I just want to say, it is effective there. Medication management is often an important part of treatment, especially when you combine it with behavioral therapists, And so just think you're working with a psychiatrist or probably a family nurse practitioner or general, MD, PCP, when you work together, that's called integrated healthcare, so you're touching all areas of behavior therapy. Treatment should address other possible mental disorders. So a lot of times, people present with access to what we call personality disorder. And people also present with pre-existing medical conditions. And so you want to look at all those areas during an assessment, to make sure that you covered your ground, your basis. And okay, does this person have bipolar? Is this person histrionic? What's happening here? And so again, you kind of almost get into like specialized care there. So there is training for that, just FYI. We're looking at medically assisted detoxification. Again, this is only the first stage of treatment. A lot of people, it becomes very intense that they need this type of detox. And they sometimes like, oh, I feel a lot better. I don't need more therapy. I don't, so they kind of go there. And then boom, they're out and about again. Drug use during treatment must be monitored continuously. So we want to have a good integrated team there with MDs, psychiatrists, whoever. And then again, treatment programs, because of the exposure of, where these individuals go, we don't know where they go. We don't know, maybe they're at a house party, maybe they went to a bar, they ended up with somebody, and that's where we're looking at the risks for HIV, AIDS, hepatitis B, tuberculosis, other infectious diseases, even COVID, just like I alluded to earlier, the riot, that physical distancing is not happening, so that transmission is spreading like wildfire. So, and then as well as teaching them about steps they can take to reduce the risk of these illnesses. So public health education, this is how AIDS is spread, and this is the way, you're at risk for it, or this is called TB, real general information and providing that to them. Next slide. So things to consider while, treatment is going to happen, or you think about it, you're contemplating. So think about harm reduction strategies. What can be done? How? You kind of got to get really creative sometimes. Considering when an in-person visit is needed versus a telehealth visit, so maybe these individuals need an in-person visit. How are you going to set that up internally? How's your team going to handle that? So room-to-room telehealth. SAMHSA suggests opioid treatment programs provide take-home medications during COVID with the pandemic that's ongoing, so again, we're considering all these preventive measures, that was put in place by CDC. What can we do? How do we get creative? There's some Indian Health Service hospitals and clinics that are doing like drive-up pharmacy services. Social isolation is a risk factor for relapse. So again, hoping that they have the means. I know a lot of times reservations, we don't have the broadband capabilities. Maybe we have lifeline phones that don't have the apps, that can allow us to Zoom, looking at things like that. If it's available, that virtual support is good. So that could be, useful. Again, if you're capable of, the internet and all the software, whatever's needed. Integrated behavioral health care, that's when you could set up between, your mental health clinic and behavioral health clinic, with maybe the ED or, family practice, so looking into that, how can we set this up? How can we develop the system? Creating a task force team to address substance prevention. So I know that in some tribes, they do have a similar, government setup with all three branches, executive, legislative, and judicial, and what can you do together? Maybe You could do an executive order saying, okay, you know, because it's suicide month or substance abuse prevention month, you know, what can we do to create a team of, you know, specialists? You know, so-and-so is a good public health educator. So-and-so is a good epidemiologist, you know. We have a good police officer over here that knows how to talk to our people, you know, when they're arrested because of substance use, you know. So you bring all those key players and get at a table and you start to debate and talk. And I'm sure it's happening, and it has happened, you know, with a lot of our American Indian Alaska Native people. Next slide. Creating a crisis response team as a wraparound service. And so here, you know, you're looking at law enforcement. How can they help? We're looking at medical doctors. We're looking at ED providers. We're looking at mental health team. We're looking at, you know, even the CHR, you know, you're looking, depending on the need of your community, you know, you create a team based on that. And how's the system going to be prompt? How are people going to be put on alert? You know, so you look at all that. And then you create, you know, your team, you create your system based on that. And not all systems will be the same. You know, there'll be some things that work for one community that doesn't work for another. So, and then sometimes, you know, we get a lot of these medical models from a national, federal level, and a lot of times that's not efficient. So we have to indigenize, you know, these types of models to fit our community. So it's okay to do that. Educate providers on substance use prevention. So a lot of us, you know, we're old school. I know I am, you know, and so there's always new information that's coming out that I don't know about. And so you want to be able to update and educate your providers, you know, on substance use prevention. What is out there? Who came out with the new medical model, you know, so just keeping yourself up to par. Create positive messaging to prevent substance use. And so you can use the radio, you can use the newspaper, you can make a flyer. You can put it online, you know, put it on your tribal webpage. Maybe, you know, when you drive around messaging, you know, on the, what do you call those boards? Lost my mind. The ones that blink like a casino. I forget what those are called. But, you know, putting your messages up there and constantly, you know, maybe you can go on air live and talk about it, you know. So there's various ways, you know, that's effective. So always putting that message out there. Incorporate psychoeducation with treatment plans. So here we're talking about maybe group education. So maybe as part of their treatment plan, you know, when they come once a week, they're going to go in as a group, you know, and sit in a group session where the provider will be the one to you know, say, okay, X, Y, and Z, you know, this is what's happening. This is what this means, you know, providing basic education. Thank you, tribal billboard, there you go. So thank you for that. That's what I was trying to think about earlier. Allow providers to receive professional training or education to improve their treatment strategies. You know, as tribal people, as natives, you know, we see a lot of new things that are coming. I want to use the word mutation, but not genetically or biologically, but, you know, it's always ever changing. Something's always happening, you know. There's a new thing that comes out, just like salt baths. I didn't know about that, but I guess people have been using salt baths that we thought the purpose was for an actual salt bath, but they're using it in different ways, you know. And so we won't know about these things unless we're educated. So, you know, I just express to those that are health administrators that are on, or tribal leaders, you know, to really support these providers. You know, so the more they're educated about, you know, what's happening, the more help they can provide to the people. And so again, you know, that I would appreciate that. Incorporating the YRBSS, Youth Risk Behavior Surveillance System, and that's really good, you know, to help identify needs. You know, what are the young children going through? What's happening? What are they experiencing? How long have they experienced this? How are they coping? So that really brings a lot of information to the table, and then you kind of look at the similarities. And incorporate other types of needs assessments. Maybe you can make one up, you know, how do you gather data or what's out there, you know? And so again, you know, you just become creative. Next slide. So here, questions and comments are welcome at this time. So go ahead and go to chat box. It'll be myself or Courtney. I don't know if my colleague's still on, Robert. We'll be happy to answer questions. If we can't answer it, off the bat, we'll look for the right answer, and provide that to you after. Thank you.
Hi, Dr. Segay, we do have a few questions that we received before the webinar. We can start with those while people type theirs into the chat box. So the first question was, what resources are available to tribal members with addictions who are also COVID-19 positive?
So here at the end of our slide deck, I've incorporated a lot of different resources. So they're hyperlinked and there's a lot of good information there. There's so much information. I can't just discuss one. And so again, just look through the resources. If it's something specific, if you could email me, we can discuss that more offline. Sometimes it's, very detailed. But again, there are services out there for individuals who have substance disorders and who are COVID. Basically, we're again looking at preventative measures as you're developing a system for them that they can get help. It's just getting creative and working around these parameters. So I'll just leave that at that for now.
Okay. Another one, we have a pregnant meth and alcohol using 32-week tribal member who has refused to answer calls for case management. We had contact at first. Even her mother is refusing to talk with us. Any ideas or suggestions?
Okay, so with that, I would basically, when I practice in my day, what seemed effective was a welfare check. So you can, contact the law enforcement and let them know, these are my concerns, this person's at high risk. Can I get an officer to do welfare checks? So that seems to be the most effective way. And then if you have a crisis response team, I've seen where there's a request from the providers that, so-and-so hasn't came in, hasn't answered calls. Can you go out there and do a check? And so the crisis team can go out there and, check on this person. So that's pretty much how I know that's handled. Thank you.
Someone in the chat box mentioned civil commitment.
Yes, in some areas they do have that. It depends on the law there with the tribe. How do they do an involuntary commitment, what's required? And so I know they have some conditions. So as long as those conditions are met, I don't see a problem of, getting that involuntary commitment. And so that's also very, very helpful. In some cases, family members will come forward and say, my dad has this problem, can we request it? Can you help us? Sometimes even the persons themselves will approach you and say, I want to go to rehab, but can you make it court ordered? That's the only way I'll do it. Some of them will make a request on their behalf. Just some examples.
We also had some resources shared in the chat box. White Bison Elders Meditation or Native Wellness Institute. So those are some possible resources to suggest to people. Someone else also mentioned that the Urban Indian Health Services in Arcata, California, they have a talking circle. So that may be something for people to follow up on who are in that area.
And here, William has a question. Child in need of services through court and social service. So unfortunately, children seem to get caught up in this web, if their parents or parent is using substances, and it makes it very complicated. So a lot of times that's where, these little babies, they get involved with the court and social services. And so sometimes it is necessary. For example, social service, I know they'll do a thorough assessment and then they'll have a case plan. They develop a case plan, and sometimes on the case plan, they recommend parenting classes, parenting skills, So they're looking at reunification. How do we set up a healthy reunification between a parent and their child or children? And so that's where sometimes they want to go to rehab, and sometimes some rehabs will accept the children to come along with the parents. So that's really good when it's like that, so that way, that relationship is being worked on as they're, in recovery. So just want to answer that for William. Thank you for that question.
Another resource that was suggested, Perkins Family Clinic at the Iowa Tribe of Oklahoma, they have a virtual talking circle. So that's some options if internet access is available to do some virtual talking circles or other support services. As a reminder, please type your questions or comments into the chat box. And I also want to remind everyone that a recording of the webinar as well as the slides will be available within a few days.
Thank you for that, Courtney. Let's go ahead and finish our presentation here. Thank you for your questions, your comments, your recommendations. Really appreciate it. So go ahead and go to the next slide. So here we got some take-home messages. With this public health education you received today, I hope it helps you to understand, what substance use is. It might not be extensive, but we want you to walk away with some basic knowledge. Okay, this is what it is, and also to help you advocate for those who suffer from substance. So now that you have probably a more general idea, it kind of helps you to develop a direction for people you advocate for, how to help or who to tap into. How to recognize substance use symptoms. So we went over some symptoms earlier with JW's case, work obligations decline, activity declines, so all of that. And then using coping skills and or getting professional help, so we went over some possible skills like exercise, getting into activities, spending time with your pet, your animal, so we kind of got into that. And then getting professional help, how do you get professional help? When do you get it? Whether it's a recommendation that is made, or, somebody who just comes out to you. You say you're at a flea market and somebody comes up to you, they trust you enough and, I want to get help. How do I do it? So again, be mindful of, they're set up differently. So learn about how your system is set up so you know where to send them. Next slide. So closing here, I just want to stay on time. Next slide. So here are some related resources there. So there's a lot of information there. And these are assessments, surveys. Next slide. Some more additional resources. So there's guidance for law enforcement, first responders, even going down to letter to treatment providers, virtual recovery resources. These are all hyperlinked. Telework, DF, WP, drug testing. Next slide. And more resources, opioid treatment program, guidance again for patients quarantined at home with coronavirus. Next. And these are our references. So those are what we used, to create this PowerPoint and this public health education for you today. Next slide. And again, feel free to send us your comments, your questions. You could email us too if you think of something later. Next.
Oh, there is one more question if we have time. Or more so.
Sure.
We received this one. We welcome ideas on how other communities have dealt with the methamphetamine problem in their pueblo or reservation. So if someone wants to share what they're doing, either in the chat box or you can email us and we can share out those resources.
Thank you for that. So just be mindful that we had some people that got kicked out from a webinar. I apologize. I don't know how that happened. But again, Slides will be available, you know, for your use. Next slide, please. So please complete your evaluations. Courtney will send you a link. It's very simple, I promise you. I know some of us, we think it's a pain, but you know, we really appreciate your evaluations to improve our services to you all. Next slide. And yeah, thank you. Aho, that ends our day. Take care of yourself. Thank you for everything you do. We love you, we need you, and take care. Thank you for joining us.